So it's my pleasure to present Dr. Robert Saper, Rob, who's the Director of Integrative Medicine for the Boston Medical Center, Department of Family Medicine, and Associate Professor in the Boston University Schools of Medicine and Public Health. Rob.
Thank you, Dan. Good afternoon, everyone. I hope you all had a very pleasant and healthy lunch. Thank you for the opportunity to moderate here at today's session. And session 3 is policies to promote evidence-based non-pharmacologic approaches. And the overarching question we're going to be asking today are what are the policies in all different domains that will help lower the barriers and accelerate change towards greater use of non-pharmacologic therapies. I'd like to bring up our panel as I introduce them. Ms. Penny Cowan is founder and the current CEO of the American Chronic Pain Association. Dr. Robert Banakdar is Director of Pain Management at the Scripps Center for Integrative Medicine. He serves as Assistant Clinical Professor at UC San Diego and is past President of the Academy of Integrative Pain Management. Dr. Beth Darnell is a clinical professor at Stanford University in the Department of Anesthesiology, Perioperative, and Pain Medicine. Dr. Daniel Carr is past president of the American Academy of Pain Medicine. He is an academic at Tufts Medical School and the founding director of its program of pain research. Dr. Harley Goldberg, he served as physician executive at the Northern California Kaiser Permanente Medical Care Program. He was the founding director of the Complementary and Alternative Medicine Program at Kaiser, as well as the Spine Care Program. And Dr. Buckenmeyer, retired colonel of the U.S. Army, is the program director and principal investigator for the Uniformed Service University's Defense and Veterans Center for Integrative Pain Management. He is a professor of anesthesiology at the Uniformed Service University of the Health Centers. Thank you and welcome to a terrific panel. Next slide, please. My disclosures: I receive research support from the National Center for Complementary and Integrative Health, PCORI, Optum Labs. I've received honoraria and royalties from UpToDate, as well as Optum Labs. And I think it's important to not only include financial disclosures, but we all have interests in many, many areas. And it's so important, obviously, to have those interests fuel our passion, but also have equipoise towards the research. I am a past chair of the Academic Consortium for Integrative Medicine and Health, and I'm very proud at a personal level to share with you that after 30 years I earned my yoga teacher certification a number of years ago. I have one other disclosure which I haven't mentioned here, and I think this disclosure is also shared by many of you, and that is a passion to help the patient in front of us, or the patient that we impact, with whatever helpful possible tools are present. And although evidence, which is so critically important for influencing policy, it is necessary, but it is not sufficient. And what is also needed, in addition to finances and appropriate stakeholder engagement, is individuals who have experienced the impact of this type of approach in some way. So that may be direct experience, such as myself when I was a medical student. I was very burned out, per se, and I had my first yoga class, and that was a real eye-opener for me. But also as a practicing family physician, when I see my patient, a 46-year-old woman, immigrant from Africa, has experienced PTSD, trauma, a history of genital mutilation, she has morbid obesity, type 2 diabetes, and fibromyalgia. It is incredibly compelling as I sit with that person, to want to be of service. And whether we're a clinician, an academic, a funder, we identify and we have some type of experience that fuels our desire to do this work. And I think it's just important that we all acknowledge that. On the lines of experience, we've been sitting for quite a while, for a day and a half, and I'd like to lead you through a 2 or 3 minute experience that I will deduct from my total 10 minutes, so don't worry. Even the moderator does not get a freebie here. And so if you like, you can close your eyes and uncross your legs. And you can leave your eyes open or a soft gaze towards the floor, or close them. And begin to be aware of the breath. The breath is an anchor to the present moment. And as you inhale, feel the expansion of the belly, ribs, chest, upper shoulders. And then on exhale, the reverse, a relaxation of the upper shoulders, chest, ribs come in, belly comes in. And continue this deep, full breath. And for these next few moments, there's actually nothing else you have to do or think about or email other than simply attending to this breath. On the next inhale, raise your shoulders towards your ears, and on the exhale, roll them back and down. And continue in this cycle, inhaling as you lift towards the ears and exhaling as you bring your shoulders back and down. The movement is coordinated with the breath. Imagine it's like a massage of the shoulders. And allow the shoulders to come down and relax. And when you're ready, you can open your eyes. Thank you. Although we are here for many reasons, there is absolutely no doubt that the opioid epidemic and all the sequelae thereof have heightened the focus on pain management and what else we can do other than medications. And so much of the policy changes have focused in on making sure medication-assisted treatment is available, making sure detox facilities are greater availability, regulations to decrease opioid prescribing for physicians. But we need to look upstream, obviously, at pain. So, in 2012, 126 million Americans presented to a physician in complaining of pain in the last 3 months. In 2016, 215 million opioid prescriptions were dispensed. That's approximately 66 opioid prescriptions per 100 adult Americans. Now, not all those opioids were misused or abused, but national data shows that 4.7% of those opioids were either misused or people went on to abuse them, and the majority of causes, 60%, was for pain. Now, when national queries of users of heroin are done, and heroin users are asked, did you use prescription opioids prior to the initiation of heroin? 47% admit the use of prescription of opioids prior to heroin use. And more concerning is that heroin users concomitantly or concurrently use heroin and prescription opioids. And of course, now heroin has become laced with more fentanyl, a very potent opiate, and overdose is quite common, resulting in 2016 in 63,632 deaths. The number of overdoses we don't have good estimates of, but easily 4 to 5 times the number of those deaths. This is why we're here. This is not the only cause of overdose death. It's not as linear as I've laid it out, but it's a critical piece that more and more people are becoming aware of. So we're going to be talking about policies today. And I'd like to lay out as a context for all of you what I call the 5 A's. And these are barriers and opportunities to promote evidence-based non-pharmacologic approaches. And they are awareness, acceptance, availability, accessibility, and affordability. And what I've listed here on the right are the major groups of stakeholders that are in this room and you'll be hearing from today: patients, providers, educators, health systems, and payers. Most of the time, when we discuss barriers, we all talk about insurance reimbursement and affordability. And obviously, that's critical. But that is not the only barrier. We could have all the insurance coverage we want, and we are still going to have plenty of barriers, and I would say, conversely, opportunities. So awareness is relevant to all these stakeholder groups. Acceptance, also all these stakeholder groups. Availability to patients, providers, health systems, and payers. It may be available, but can the patient get there? Can they access it? Does the provider know where to send the patient? How does a health system create these services in the multiple areas that that health insurer serves and that system serves? And then lastly, payers. How does one provide reimbursement for this? And not only reimbursement, you can have great reimbursement, but a $40 copay, and that doesn't make things affordable. So this is a context that we're going to be hearing a great bit about by some terrific panelists. And so I'd like to invite now Ms. Penny Cowan, representing the American Chronic Pain Association, to speak about the patient perspective.